6:43 now. Let's check on our top stories this morning. Budget cuts still receiving some bad reviews. Dozens spent their day rallying in Decatur yesterday.
Show me what democracy looks like. This is what.
These people are concerned about the governor's plan to slash child care services. The Child Care Assistance Program offers discounted rates to low-income and working parents. The governor wants to cut millions from the program, and he also hopes to increase copays. Advocates say the cuts would hurt both parents and daycare workers.
Local home health care workers and the disabled joined forces to protest possible funding cuts by Governor Pat Quinn. Bob Ryder joins us in the studio with the story. Bob?
Mimi, many people count on home health care for basic needs and health issues. And if Quinn's cuts go through, they could be forced into a nursing home against their will.
I can't do anything anymore.
Pat Whitman takes a stand against proposed budget cuts to a state program that funds home health care workers. She was one of many speakers at a news conference today held by the Service Employees International Union, which represents many of those health care workers.
Because if he cuts it, that means my life is over. He doesn't need to cut the DOORS program.
Pat suffers from congestive heart failure and diabetes and is no longer able to work after 5 back surgeries. She counts on her daughter Heather to take care of her basic needs and some medical care. Heather works for the Illinois Department of Rehabilitation Services as a personal assistant. She fears budget cuts could mean she would no longer be able to care for her mother.
I just don't see any reason to cut any more budgets. I mean, this is especially one program that we really need to keep. There's too many of them out there that really need the assistance.
Dawn Stanley, a local home health care agency director, says her agency helps almost 2,000 disabled in the state line. And if the cuts go through, it could devastate many more lives.
And with the 22% number that's being thrown out there, with the 22%, it would affect approximately 429 of those current clients would not be eligible for services.
Well, we're going to keep working and talking to the governor and talking to the people in Springfield to make sure that we fight for those services.
Many of the health care workers I talked with today told me they are making less than $12 an hour for very physical work.
Bob, if these patients go to a nursing home, that could cost the state even more money.
That's one of the arguments the union and Representative Chuck Jefferson made today. Now they'll take that argument to the floor at the State House.
Healthcare providers are asking state lawmakers to find another area to cut the budget. Those who work for Illinois' home care program say the state's proposed budget cuts would cripple their care for seniors and people with disabilities. One care provider says the home care programs allow